Thanks for joining us on TVC News at 10. We begin tonight with updates on the sad incident in Ibadan, your state, where police earlier today confirmed that 35 children are dead from the Funfair stampede and that 6 others are critically injured. Senior reporter Olaide Oyewole has more.
The city of Ibadan is still reeling in shock and grief following the tragic incident that occurred at a funfair in the city, resulting in the death of 35 children and leaving 6 others critically injured.
Madam,
according to the statement made available by the Oyo State Police Command, the organizers of the event, including the main sponsor, Naomi Shilekunla Ogunwusi, and a media partner at Gidigbo FM, the principal of the school, and 5 others have been arrested in connection with the tragedy. The police stated that the event was organized by Wings Foundation and media partners at Gidigbo FM without proper permission or safety measures in place. The police said they have commenced an investigation into the incident and promised to bring those responsible to justice. Meanwhile, the chairman, Medical Advisory Council of Oyo State Specialist Hospital, Adioyo, revealed that 4 persons out of the injured victims are still receiving treatment.
But yes, they needed to be treated, and that's why they were admitted, resuscitated, and we are looking at them to be sure that they are okay. And they would, once they've received adequate attention and care, they will be released to their parents to go.
The city remains in a state of shock and grief, but there is a determination by the state government and security agencies to ensure that such tragedy never happens again. Olaide Oyewole, TVC News, Ibadan.
And still on that unfortunate incident, the chairman of Gidigbo FM in Ibadan has been hospitalized after slumping and losing consciousness, reportedly due to shock over the tragic events that unfolded at a funfair yesterday, Wednesday. According to a source who wished to remain anonymous, the chairman is currently receiving treatment at an undisclosed hospital in Ibadan. The source revealed that the chairman was unable to cope with the shock of the tragedy. In the meantime, President Bola Tinubu has expressed sadness over the incident, resulting in the loss of innocent lives with others injured. The president extended his condolences to the government, people of Oyo State, and grieving families who lost their beloved children. President Tinubu is urgently directing the relevant authorities to investigate the circumstances of this tragedy thoroughly. He's emphasizing that it is imperative to determine whether negligence or deliberate actions contributed to this painful incident, ensuring a transparent and accountable process. The president urges the Oyo State government to take every necessary measure to prevent such a tragedy from recurring. He also calls on event organizers to prioritize the safety of all attendees, especially children. Our senior reporter Olaide Oyewole will join us soon for more updates on this developing story. Away from Ibadan to Abuja, where the National Assembly has passed the 49.7 trillion naira proposed 2025 appropriation bill for second reading. But this is barely 24 hours after President Bola Tinubu presented the fiscal document to a joint sitting of the National Assembly. We have more in these packages.
Part of the day's legislative business, members took turns to speak on the 2025 fiscal document led by President Bola Tinubu on Wednesday. House leader says the ambitious spending plan will impact the lives of the people once passed into law.
What the budget has done is to isolate those critical areas that have far-reaching implications for other sectors of the economy.
Lawmakers commend the ingenuity of the executive in coming up with a spending plan of 49.7 trillion naira, but some raised concerns about implementation.
So debt management is critical to our national development and preservation of our international reputation.
Investment in the health sector is going to contribute to sustainable development growth in this country, and majority of Nigerian women and children will benefit from this.
The area
of attention is said to be defense and security, infrastructure, education, and health. My question is, what about human capital development?
Other areas highlighted for priority attention include insecurity, fight against graft, food security, increased sectoral allocations, expansion of tax net, and environmental sustainability.
We should also look at how we are to increase the production sector and the local content of Nigerians.
We are hoping that the executive will not further request for loan to add more burden to the economy.
The executive, in their wisdom, to deploy technology in order to live, if not permanently, in the board, our security challenges in our country.
President Tinubu's 2025 spending plan has now been referred to the Committee on Appropriation for further legislative action as the House goes on Christmas and New Year break to resume on the 14th of January 2025. The House has now extended the implementation of the capital components of the 2024 budget from 31st December to 30th June 2025, while work begins in earnest on the 2025 appropriation bill. Joke Edson, TVC News, Abuja.
President Bola Tinubu has allocated 2.48 trillion naira to Nigeria's health sector in the 2025 budget. This boost represents about 5.18% of the 49.7 trillion naira total budget estimates. TVC News' Kemi Balogun has more details.
The debate over improved healthcare funding in Nigeria will continue, but for now, the 2025 budget shows that the present administration appears willing to step up to the plate in giving citizens an improved healthcare system. As stakeholders urge the government to prioritize health in national planning and ensure the well-being of its citizens, President Bola Tinubu has now given a boost in the budget for healthcare. This time around, it is pegged at 2.48 trillion naira, which is the highest in more than 3 decades. Healthcare now has 2.48 trillion, representing 5.18, an increase from 1.3 trillion, which is 4.6% of the 28.7 trillion in the 2024 budget. 402 billion naira has been allocated for infrastructure investments in the health sector in the 2025 budget, and another 282.65 billion naira for the Basic Healthcare Provision Fund. Although the proportion that has been allocated to healthcare in the 2025 budget still falls far below the Abuja Declaration expectation in 2001, experts still believe that this budget is an intentional one.
The last 10 years, our budget, fairly remained the same, around 5%.
Dr. Aminu Magashi is a coordinator of the African Health Budget Network. He says this budget has unique allocations, which makes it better than previous ones.
A little paradigm from the previous one. We don't normally have that kind of big money, for infrastructure in the health sector. And last year, 2024, the Basic Healthcare Provision Fund was around 125 billion naira. It has doubled this year. Both in value and numerically, we have more money this year than the previous year.
With an existing plan to strengthen primary health care, revitalize hospitals and ensure access to quality care for all Nigerians, this expert believes utilization of funds still remain key, especially in reducing the major issues hindering major health indices, like addressing maternal mortality, zero-dose children and others.
We need to ensure that our pregnant women, they are attended during antenatal care, they have a skilled birth attendant and facility delivery. We need to ensure that our primary health care, secondary and tertiary, they have fully functional facilities. Electricity should not be a problem. With all this budget, we should manage our money in a very efficient, transparent and accountable manner, and we can celebrate Mr. President if we can achieve that.
Some Nigerians express their satisfaction on the increased health budget, but say more needs to be done.
This budget will be impactful, and though we are like Oliver twins, we always need more. We want more, a kind of standard hospital, good access to medicares, and issues that has to do with child and woman mortality.
There has been an increase in their services, but the one I want the government to look into is in the high prices of drugs.
The Coordinating Minister of Health and Social Welfare, Professor Ali Pate, revealed only recently that there has been an exponential increase in financing and expansion of primary healthcare services, which has led to over 10 million Nigerians accessing critical services in the Basic Healthcare Fund primary healthcare centers in the last 1 year across the country. Nigeria's healthcare will still need to remain a priority for many more budget cycles in order to address the persistent and evolving challenges that still face the health sector. Kemi Balogun, TVC News, Abuja.